All right, everybody, welcome. This is Nancy Sasaki. I'm the Executive Director at Alliance Healthcare Foundation. We're going to go ahead and start the webinar on our innovation initiative that launched last week and will be open online applications until May the 4th. What I'm going to do today is run you through a lot of what we're looking for in the application, try and answer some of the questions that you might have ahead of time, and then also just continue to let you know that I am always available. Should you have questions, if you want to run your idea by me, please feel free to reach out to me. Email is probably the best way, or you can call and leave me a message as well. So first of all, I want to talk a little bit about what we consider innovation to be. There's a lot of times that we get proposals in that I would say are creative, but they don't necessarily rise to the level of innovation that we're looking for. So most all of them need to look at creating some sort of systems change, where you're looking out there in the services that you provide, and you're thinking, you know, if this were different, I could serve more people, I could really lower my costs, or I could improve the quality of the care that we're providing. And not only just for me, my organization could really do this for the people that we're serving, but it would be such a huge change that others that are also providing this kind of service would want to make that change as well. And that's when you get to the level of systems change, because you're starting to have an impact on the way people are doing business and providing services to the people that we care about. It can also prepare for the future by doing something different. The Innovation Initiative came about because back in 2010, when Obama was talking about the Affordable Care Act, we heard from the community that they were really worried about implementation in 2014 because they didn't feel like they had the capacity. They didn't feel like they had the number of providers that they would need. They were very concerned that people were going to be coming into their clinics that hadn't had health care for years, and that they would be sicker and have more and greater needs, and potentially even costlier needs than they were accustomed to. And so we said, well, then tell us what you want to do now to prepare for that in the future. So let us know, like, what is that change that needs to happen now so that you can serve the people that you see are coming in. And we're certainly in that kind of an environment right now where people are wondering what the administration is going to do with funding, what's going to happen to our ability to provide the services that we've been providing, not only from a funding perspective, but because rules and regulations may also change. So what are you thinking about that you need to do now, besides just have different money coming in or a new revenue stream? You know, what are you doing now to try to prepare for that? It also, as I've already mentioned, it impacts cost, quality, and or capacity. So one of the things you'll really need to be able to do in the application is be able to tell us about how you're impacting 1, 2, or 3 of these areas. How are you going to reduce the cost? Because we know there's no new money coming into the system. So what are we going to do to try and reduce those costs? Or is it a capacity issue that you just need to be able to serve more people? And by making these kinds of changes or making this kind of service available, you might actually be able to serve more people. And it's also important, and you'll see in the application, that it uses data to support the idea. This is a place where our board is looking at how do you prove that there's a problem? How are you proving or going to measure whether or not the solution that you're creating is going to solve that problem? So there's different places where data is really important if you have it. And it may or may not use technology. I know that in the very beginning of the Innovation Initiative, a lot of people in the community really felt like this was a technology initiative. And that couldn't be farther from the truth. And one of those areas that I can talk about is funding solutions for change and the expansion of the aquaponics farm, which is really just you know, having the land and the wherewithal to expand the amount of food that they could produce, these baby organic greens. So it may or may not use technology, and that certainly doesn't have to be the highlight. Many of the projects that we fund do have some form of technology in them. It's not that it doesn't have to have any technology. You know, and this is also another area where it's really good for me to note that in our process, we do select 5 finalists to go forward to present before the board. And many times the board is really trying to choose between one or two proposals, and there's usually just one little thing that pushes one over the other that causes them to select the one that they do. But we typically have some really strong contenders in that pool of finalists. And we have had a couple of occasions where people have come back and presented a second time, and the second time they're successful in getting funding. We've also had those periods of time where the funding needs to end early, that there were circumstances typically beyond the control of the organization that caused that funding to no longer be innovative, or it was something that was happening internally to them that they weren't able to really get off on the pathway that they thought. But that's also a part of the process, and we don't necessarily see that as failure. We see that as a real learning opportunity, because it may be that this project can get up and running later on down the road when some of those pieces are better in place. Where you need to be serving is in San Diego and or Imperial counties. The organization can be outside of this area, but the impact of the services provided or the project or the program or whatever it might be needs to impact the people that we're trying to serve in one of these two counties. You can also look at this in terms of like a different area of San Diego County, so that's why we have the different regions and everything. You might be actually focusing in on the South Bay, but if your project is such a great systems change, it could eventually impact all of San Diego County. It could include Imperial County. It may be so awesome that it actually goes nationwide and maybe even internationally. But we're going to start off here in San Diego and or Imperial counties. And we like to see that if you are happening to be an organization that's based outside of San Diego County, that you have a partner agency in San Diego or Imperial counties. And that's because we found through our 7 years of practice with this is that many times the local organization is the one that becomes the real champion for that project or that program in the community. So we really like to have that partnership established. In terms of the qualifications, we do look for it to be a 501c3 or that it is partnered with a 501c3 that can act as the fiscal intermediary. As I mentioned, if the county is outside of, if the organization is outside of our two-county area, then we want you to partner with an organization here locally. We do look for this to be fully implemented within 3 years. That hasn't always happened. We do develop a very strong partnership with the project, and you know, that means that I'm very knowledgeable all along the way about the challenges and barriers that the program faces. But we do look to try to have it fully implemented in 3 years. We do like to see that there is an evaluation component included as well, because we want to know, how are you measuring whether you're on the right track? How do you know if you need to tweak something? How do you know when you need to like take a left turn on something to really make this more effective and be more and work stronger? And then it also needs to be innovative, as I had mentioned before. As I get into the application process, you know, this one's kind of one of those that you all know about. It's all about the demographic data of your organization. Understanding your mission statement is very important, because that's one of the measures that we'll use to align this, to make sure that this aligns with our mission to advance health and wellness. We also ask some of the financial information with regard to indirect expenses. We also like to see what the group looks like that's helping to run the organization, whether it's board members or executive management and staff, and then just how to get in touch with you. Our target populations, the target populations for Alliance Healthcare Foundation, are two very broad areas that include the poor and the working poor, otherwise under 250% of the federal poverty limits. Also those who are uninsured and underinsured, and that certainly has changed in terms of who falls into that category. First, with the implementation of the Affordable Care Act in covered California here in the state, but then also looking at what are the changes that might be anticipated under the new administration that may impact this number as well. Then we have two very specific target populations that we consider to be the more vulnerable, and that is the homeless and children. And you may hit one of these, you may hit all four of these. but those are the target populations that we're looking for. We also want to understand the demographics about the people that you're serving in terms of the gender, the race, their age range, and then also, to the best of your ability, the number that you intend to serve, whether it's a hard and fast unduplicated number or whether it's an estimate that you're going to be striving for. As I mentioned, we're looking for San Diego and Imperial counties, so we want to know what region you're serving, and so you will identify that in the application. Now I'm going to move into the 8 qualifying questions. This is actually what you'll see when you open up the online application, which you can find on our webpage. There are 8 questions, and we're really looking at this much more like a business plan, something that's very different than your typical grant making, your grant proposal rather, sorry about that. So we want you to be able to state the problem that your project will address. Using data, how do you know that this is a problem? In our previous grantees, they've identified the problem as an adherence to medication to cure the disease, whether it's connecting social service information to medical information so that providers have a complete picture, or that they're looking for a one-stop shopping for all of the benefits that that a person might need. So really describe what the problem is that you're trying to solve and how many people don't have access to that, how many people are experiencing that problem, and having that data to back that up. And why do people need your service or your project? What is the value proposition for the people that you're trying to serve? Why will their lives be better because of what you're creating? The project overview is the second question. This is where, now that you've described the problem, you're going to spend some time describing what your project is. What is the impact on the people's health? What are your goals and your purpose? What are the kinds of accomplishments you hope to see? And why you or your organization? If this is such a great idea, this is such an innovative type of thing, what's going to happen when there's competition? Why will people continue to come to you as the organization that they should get this service from? And then your market analysis. And this is probably an area where we see a lot of people haven't done this work. And it's not that it's a strike against you in any way, but to the degree that you can, how do you know what the demand for your service is going to be? What are the trends? Are the trends kind of leaning this way? And many of y'all know that I worked with Planned Parenthood in my previous career, and one of the things that you could see was there was a trend away from taking a pill a day, that people were really looking at those long-term, long-acting types of reproductive health care. So is that trend, what kind of trend like that is happening? Are people moving away from, are they moving away from Facebook and going into Snapchat? You know, what are those kinds of trends that are happening that are going to impact the problem as well as the project and program that you're trying to develop? How many people need your service, and what percentage of that need do you think that you're going to reach? So when you're talking about your market analysis, there might be 100 people out there that need it, but you're going to strive to reach 50% of them, and that will be success. Or if you're really starting out in a smaller project, you might want to try to reach 10% because you want to test it out, you want to tweak it, you want to be able to understand how it's impacting the people that you're trying to serve. And then how well do you know your competition? Who might be moving into this market if it's such a great idea? The question three that you'll see on the application is the key elements of innovation and how it advances health and wellness. So what is so different about what you are proposing? And this is where I was talking about innovation and creativity. Sometimes we see creative uses of current projects or products, but we want to know why it's innovative for you and your program that you're developing and how it's really different. The backdrop to our creation of the Innovation Initiative was Dr. Jeffrey Brenner. And he took Medicaid data and he looked at it to determine who the high utilizers were of Medicaid services in their community, and especially at the hospital and especially in the emergency room. He identified where those people lived mostly and set up a project that provided services in those areas so that the people in those areas were no longer accessing the accessing the ER, which saved millions of dollars, and there was no use of technology. That project has since grown to be a huge organization that is really bringing this program and project to all of New Jersey. So you never know where it's going to go, but where is it going to start is what we're going to be looking for in this particular question. The fourth question is around what I've also already mentioned with regard to cost, quality, and capacity. This is where you need to understand your own metrics and your own analytics. How are you going to answer the key elements with regard to how you're going to reduce costs or improve quality or increase capacity? You know, everybody talks about how you're going to, quote unquote, move the needle. So what are you going to do that's going to do that, and how will you know whether or not you've done it? And once you've done it, how will you know that it even mattered in terms of advancing the people's health and wellness? The fifth question has to do with project leadership. And this is one of the main areas that in watching the board and what really influences them, that leadership can really matter. And it may be one person, because I certainly have seen when a person is doing the presentation that their passion and their commitment to the project is so strong that there's no way they're going to let the project flounder or fail. And that's one person, but the leadership team is also just as important. Excuse me. The leadership team is just as important because sometimes, as we saw in one project, where they were trying to do a project that would include online sales, and yet they had nobody on their team that had ever done retail sales, one, nor had they ever done sales online. So you can look at the team and realize that you needed to have that role filled, and it needs to be addressed, whether you have it as you write the proposal or you recognize that it's a place that you need to beef up. Either way, that's really good for us to know with regard to the leadership team. And then sometimes we've also seen this happen as we get into the project, where Solutions for Change in their aquaponics farm, they actually had a really strong aquaponics person, but they found somebody that knew how to build aquaponics farms at scale, so really big. I mean, they went from 5,000, I forget the numbers, they went from like 5,000 square feet to 22,000 square feet. So how do you expand into that realm and understanding what you need on your team to be able to make that effective and successful? The sixth question has to do with the sustainability plan, and this might be one of the areas where we have the weakest, that's usually the weakest in the proposals. It's really hard to kind of get that if there's no new money coming into the field, only more people, how are you going to measure your progress? How do you know that you're going to be on track? But how do you know that this project can last beyond the $1 million in funding? You'll see in one of the upcoming slides that I talk about giving us a true budget. So even if you know going in that this is a $2 million project and we're only going to give you $1 million, how are you going to get those additional funds? And when those additional funds run out, how does this project continue to sustain itself? Hopefully it will be able to have some components that aren't a continuing reliance upon philanthropic funds, but sometimes that's also the challenge in being able to see where those funds might come from within the project itself. So that is what we were looking for in the sustainability plan. The seventh question has to do with planning to scale the project. So many times, and probably the smart way to go is to start off with a manageable piece or a manageable section of the community, to kind of launch a project, to test it, to tweak it, to really make it fit and be as close to perfect as possible, and then the potential for expanding and rolling out as milestones are met. Sometimes that may not be within the scope of the project that you're actually wanting to get the funding for, but you're able to identify where there are other opportunities and how the project could benefit more than the population that you're serving. And it may be that others take it on and they bring it into their organization or into their community. But how do you see this as a project that could expand in that way and understanding what your key milestones are, and sometimes the exit strategy. We've had those, as I mentioned before, that have not continued to the full funding potential because we needed to have an exit strategy. And so how are you going to know as you plan and learn and tweak that there's a barrier that you're just not going to be able to overcome? And we will, believe me, if you get the funding, we will be having those conversations, and I will be supporting you in trying to get beyond those challenges to the best of our ability. And then the last question that you have on the application is to tell us about the budget. And that is really, what is it truly going to cost? And I said at the funding forum, as well as many times in other places, that we're not looking for this to come in right at $1 million or $1 under $1 million, but we really want to know what the true budget is. If we decide to fund this, we want to know, like, how far does that $1 million get us? Does it, in a $2 million budget, will that get us halfway there, or does it only get us a quarter of the way there? And if we decide to fund more than $1 million, we want to know that that's potentially what's going to happen, is down the road you're going to come back and ask us for other funds to potentially continue the project. Or it may be that we help partner with you to secure additional funds. There have been times where I've gone out on fundraising calls with the project lead to try and get others to join on board so that we can really see whether this project is something that is going to stick in our community. So when we're talking about the total cost, we are looking at your fixed costs, your variable costs, as well as the future costs of the project. You will be giving us a 3-year budget outlined by each year so that we can see what the startup costs are and where we are when we get to implementation. In our innovation initiative, it's $1 million, as you all know. Sorry about that. I can tell you that it's really a very different way of presenting a project. If you're selected as one of the 4 or 5 projects that goes before the board, you will work with a consultant. We are potentially changing this up a little bit so that it really provides a lot more support for how you develop the project. But I've said this before also, that every time the groups go before the consultant, he asks them, so what is the problem that you're trying to solve? And it takes an hour and a half for them to describe it. And then he says, well, we're going to boil that down to 15 minutes. Because in your presentation you have 15 minutes to present to the board in the blue ribbon panel, you have 15 minutes for question and answers from that group, and then you leave. And that's your opportunity. So the challenge is to convince us that this is the right investment. And it's really the investment and less about the things that you're aligning with our heart. If we select you to go forward as a finalist, you've already got us at the heartstrings. So I wouldn't spend your time trying to convince us of the heart, but trying to convince us that this business model is the best investment we could make. This slide shows you the wide variety of projects that we've funded over the years. You can go to the website and learn more about them. Some of them have recordings of videos of what they've been doing and how they got to be selected. But you can see everything from Solutions for Change that I mentioned earlier is an aquaponics farm. Text for Baby was actually testing in 2010 whether or not healthcare messages, health education messages texted to low-income women who were pregnant would help to have better outcomes for their babies, and at least it prepared them to be better able to ask questions of their providers. To Access Youth Academy, where we were looking at the network effect that could happen if young people who had no hope of going to college were able to go to college, and what impact that would have in generations to come. So you'll see that there's things that are all over the board here. So I can't tell you that this one is more likely to get funded than another. They're really looking for the one that really strikes them as the one that could make the biggest difference. So if you had $1 million, what would you do to advance health and wellness in San Diego or Imperial counties or both or even beyond? Some of the important dates for you to remember were that the deadline is May the 4th. That's at 11:59 p.m. So you have to right up until midnight. I'd advise you not to wait that long, but you have until then. The program committee will make the selection of the top 5 finalists on May the 19th. And then between May the 19th and July the 14th, you will be preparing with our consultants to provide the presentation at the board meeting. July 14th is when you'll do the presentation, and the board will make the decision at the end of the day. And then I get to call you and tell you whether or not you were funded. Typically, I try to do that at the end of the day. Sometimes it might be Saturday, but definitely try to get back to you ASAP to let you know what has happened on July the 14th. So now I have this open for any questions. And Michelle and Brian, since I can't actually see the webinar, can you tell me if we have any questions?
There are not any questions.
All righty. Well, I will tell you guys that even based on this, please make sure that you get in touch with me before you hit the send button, and let's talk about what your project is. I love to listen through it and give you feedback about where there are strengths and where there are weaknesses, so that you have an opportunity to present the best possible proposal for our board and Blue Ribbon panel to see. There's my contact information. Email me is probably the best. You can also call and leave me a message, but definitely get in touch and let's talk about your proposal. Thank you, everybody, for joining us today.